Good morning, everybody. Dr. Tyler Hamel, Kingwood Chiropractor and nutritionist. Happy Monday. Today, talking a little bit about exercises, neck pain and back pain. So oftentimes patients will ask, Dr. Hamel, so what should I do? What exercises or stretches can I do to help out with this neck pain and back pain? So this is really, really important. So remember this. If you have neck pain or back pain, headache, shoulder pain, etc., there's going to be a certain amount of inflammation that's occurred in that area. Lots of times that's why you have pain. So you have to avoid those exercises or stretches that would make that worse, right? So the no pain, no gain thing is not a good rule to follow. So think about, if just in the easiest terms too, think of it this way. If you have an ache or a pain and you're trying to do an exercise and it's causing extreme pain or significant pain, do not do it. Stop it right away, because there's almost no way that that's going to get better if you're approaching it from that side, right? It's going to cause more inflammation. The more inflammation you have, then the more chronic condition becomes, right? Sprained ankle, rotator cuff syndrome, chronic neck pain. If the inflammation is always there because we're doing things to create more inflammation, then it's never going to go away. Taking medicine or Advil, ibuprofen, yeah, that might help you feel better, but in reality, that's not going to make things better. So it sounds simple, but usually for neck pain, back pain, shoulder pain, whatever it is, there are exercises, certain good corrective exercises that should not hurt, or maybe be a little bit stiff, but not something that's going to cause shooting pain or unbearable pain or intense pain. It just doesn't make any sense. And I know a lot of people think, well, if I just work through it, if I work it out, then it'll be fine. And but it's never the case. So get rid of the no pain, no gain mentality. You can make a difference in your neck pain or back pain, shoulder pain, whatever it happens to be. So ask, say, your chiropractor or personal trainer. Always let them know, especially if there's a lot of people come in here that are exercising or work out. Let your trainers know that. Because if you don't know that, then they might just give you exercises that they would normally give somebody who doesn't have any neck pain or back pain. So think about it, just common sense. This is very, very common sense stuff that, patients come in sometimes. They say, I tried exercises for a while, but it never seemed to work, or it made it worse. It shouldn't make it worse, right? So exercises, stretches, there's corrective things you can do to help with that. And the idea, the goal for it is to, of course, try to strengthen, stabilize an area, improve posture, right? But all those things together are going to reduce inflammation. So if we can reduce inflammation, that'll make a big difference in our body's ability to heal, right? I can't say this enough. Like your body or that area, neck pain, back pain, shoulder pain, it just can't heal up if there's too much inflammation there. And no, the answer isn't just taking way too much Advil or ibuprofen or things like that, because yes, that can help a little bit with the inflammation, but it's not taking care of the cause of the inflammation. That is the key thing. So Dr. Tyler Hamel, simple stuff. Follow that rule. When you're trying to rehab or get better from an ache or a pain, do not do stuff that is causing more pain or significant pain, even though that might be, say, a movement or a motion or a function that you want to eventually do. That could be bending down, it could be lifting things, it could be playing tennis or golf. But if those certain movements are going to cause pain, then don't do it right now, right? There's other things you can do to get up to that point, but don't rush. I see that all the time with people trying to rehab injuries, as they start doing things too quickly, and it's painful for them to do it, and they think, well, that's just the way it is, but it isn't that way. So, again, Dr. Tyler Hamel, I've been a chiropractor for over 20 years. I've seen a lot. Rehab, I've seen a lot of patients with neck pain, back pain, some chronic pain, some post-surgical pain. And I can give some pretty good recommendations, I think, just because I've seen thousands of patients over 20 years. So if you have any questions about aches and pains, put them in the chat box below. I'd love to answer those. I will get to those as soon as I can. If you learned something from this video about exercise and pain, kind of what to do, what not to do, please share it with friends. There's lots of people out there. I guarantee family, friends, coworkers that are struggling in pain right now, a lot of them, you'll know that because they're talking about it or complaining about it, and they just don't know what to do. So again, Dr. Tyler Hamel, happy Monday morning. Any questions, put it in the chat box below, and I would love to help you guys out. See you soon. Bye-bye.